The infamous niacin flush is one of the most misunderstood reactions in nutritional and medical circles, a biologically normal, temporary response that has been mistaken for an allergy, adverse event, or drug intolerance for decades. This misperception has played a major role in discouraging the use of niacin at therapeutic doses, effectively pushing this powerful nutrient into obscurity despite its documented benefits in cardiovascular health, inflammation control, cognitive function, and more. To understand the flush, it's important to first recognize what it is and what it is not. The niacin flush is a result of the release of prostaglandin D2, PGD2, in response to high doses of nicotinic acid, the flushing form of niacin. This causes dilation of small blood vessels, particularly in the skin, leading to a sensation of warmth, redness, tingling, or itching, usually across the face, chest, and upper body. It typically begins 15 to 30 minutes after ingestion and can last for up to an hour, gradually fading without lasting harm. What it is not is an allergic reaction. There is no histamine involvement, no immune response, no risk of anaphylaxis. Yet due to its sometimes intense and unfamiliar nature, many people, including patients and even healthcare professionals, have mistaken the flush for a dangerous reaction. This has led to widespread avoidance of niacin, with users abandoning it after a single dose, fearing they're having a drug allergy or toxicity episode. The irony is that this reaction is a sign that niacin is actually working as intended at the cellular level. It's triggering systemic changes that reflect vasodilation and improved blood flow. The misunderstanding is compounded by the rise of non-flushing niacin supplements, such as inositol hexanocotinate, which market themselves as safer or more comfortable alternatives. While they do reduce flushing, they also tend to be far less effective in raising HDL or lowering LDL and triglycerides. These flush-free forms do not always convert efficiently into active NAD in the body, further diluting the therapeutic potential of niacin supplementation. In effect, to avoid a harmless and brief skin reaction, users are often trading away much of the vitamin's efficacy. Even worse, the discomfort of the flush has led many clinicians to stop recommending niacin altogether, particularly after the rise of statins and newer lipid-lowering drugs. Niacin's decline in medical practice isn't because it stopped working, but because the flush made it inconvenient. This is an unfortunate example of how a misunderstood side effect, not a true danger, can lead to the near abandonment of a useful therapeutic tool. There are, however, strategies to manage or minimize the flush without eliminating niacin's benefits. These include starting with low doses and gradually increasing over several weeks, which allows the body to adapt. Taking niacin with food, which slows absorption and softens the flush. Using extended-release niacin formulations, which release the vitamin more slowly into the bloodstream. Taking aspirin, 81 to 325 milligrams, 30 minutes before niacin can blunt prostaglandin release and reduce flushing, though this should only be done under medical guidance. From a broader perspective, the niacin flush is emblematic of a deeper issue in public and medical perception: our collective discomfort with temporary side effects, even when they signal a harmless or even beneficial process. We live in an age where user convenience and comfort are prioritized over deeper physiological benefit. The flush feels unpleasant, yes, but it's not dangerous, and it doesn't mean the nutrient is causing harm. On the contrary, it reflects systemic vasodilation, a process that can improve circulation and deliver nutrients more efficiently throughout the body. Moreover, the social perception of the flush, especially in patients unaware of its mechanism, has fueled unnecessary fear. It's important that clinicians and educators normalize this reaction, explain it clearly, and prepare individuals for what to expect. If patients understood that a warm, pink face for 30 minutes is not only harmless but a sign that niacin is engaging with their biology in a meaningful way, we'd see far greater acceptance of this powerful compound. In summary, the niacin flush is a misunderstood physiological response, not a medical hazard. While it may be uncomfortable, it is benign, manageable, and even a marker of therapeutic activity. The fact that this reaction has contributed so significantly to niacin's underuse is both a public health loss and a revealing commentary on how misinformation can derail the use of safe, effective, and affordable treatments. Reframing the flush not as a flaw, but as a feature that signals the activation of one of the body's most important vitamins could go a long way in restoring niacin's rightful place in the therapeutic arsenal.